Hello everyone, it's Dr. Locklear here, and I'm coming to you today with Module 4 with the concept of digestion. This is on page 217 in your Pearson text, and we will be looking at the digestive system and how it operates. So let's get started. We will talk about the physiology of digestion, so what happens when we put food in our mouth, the alterations in digestion, the relationship between digestion and other concepts, and there's a table in this concept as your other concepts that shows the relation to other concepts. The promotion of healthy digestion, so how should we eat and what should we eat, common procedures and tests that we use to look at the digestive tract, analyze independent interventions that nursing can use on an individual basis because each patient is different, the collaborative therapies that are used by the interprofessional team, and it's not just nurses. We have surgeons and dietitians, and there's medications, and so all kinds of things that need to be done for this type of situation. And we're going to differentiate considerations related to the assessment and care of patients with alterations in digestion throughout the lifespan. And there are a couple of things in here that I'm just going to tell you to read on your own, such as the assessment of the abdomen and listening to bowel sounds. You can read that on your own, and I'm not going to go over that in this lecture. The concept of digestion. Digestion is the conversion of food into absorbable substances in the GI tract. It occurs through the mechanical and chemical breakdown of food into smaller molecules. So we put food in our mouth and we chew it up, and these enzymes and things in our saliva help break the food down. With the help of glands located inside and outside the stomach. Digestion is an integrated process that affects the entire body. Everything we eat affects our body. Alterations in digestion occur when one or more of the processes that break down food and absorb nutrients are impaired. So we're not just chewing and swallowing food, there's an absorption process as well. Impairments in digestion may be caused by changes in nutritional status, such as anatomical situations with our stomach, or the effects of one or more medications. So different things can affect the GI tract. Normal digestion. The digestive system consists of the mouth, the pharynx, esophagus, stomach, small and large intestines. Accessory organs such as the liver, gallbladder, and the pancreas also are part of this system. Nutrients are substances found in food that are used by the body to promote normal growth, maintenance, and repair. And we've kind of talked about that numerous times through different lectures. The digestive system provides the body with nutrition, balancing fluids, and electrolytes. So here we can connect that to that concept. And eliminating waste, because we know when we eat and the body absorbs what it needs, the rest of it's considered waste. It works congruently with the metabolic system for secretion of digestive enzymes, which aid in digestion of the nutrients. We have to have these enzymes that break it down. Appropriate amounts and proper utilization of nutrients allow the body to function at optimal ability. For example, when we utilize glucose, this allows the brain to function, whereas a deficiency in protein may delay wound healing. So we know that what's in our food helps our tissues, helps us to function, helps our cells to work, those proteins and glucose and all of those things that go into the cell. Alterations to digestion. Motility of the GI tract moves food and fluid from the mouth to the anus, so from here all the way through. The rate and strength of peristalsis, and that's the movement as the food goes through our stomach and our intestines, are regulated by the autonomic nervous system. Disorders of gastric motility occur when coordination of the digestive muscles is interrupted in some way. Inflammation, infection, tumors, obstructions, such as those things, can affect motility. Direct and indirect factors also, food intake, bacteria, this can affect the consistency of our stools. Stress and postponement of defecation, which is having a bowel movement, can influence motility. And some children tend to hold and they'll hold it and then they get constipated. Some disorders affecting motility include gastroesophageal reflux, impaired esophageal motility, pyloric stenosis, which there's a blockage there, diarrhea, constipation, irritable bowel syndrome, and encopresis. Absorption is the process by which nutrients from food move out of the intestine and into the bloodstream. So a lot of absorption occurs in the stomach, but it also occurs in the intestines as well. Absorption occurs through active transport and diffusion. So we've already talked about that in the acid-base chapter. Various medical or surgical conditions can affect absorption of nutrients, resulting in malabsorption, and then our body can't function because they don't have enough. Some of the disorders are pernicious anemia, lactose intolerance, celiac disease, Crohn's disease, acute and chronic pancreatitis, and liver failure. All of these can affect absorption. What do we see with the alterations and the manifestations? Common symptoms that indicate a possible alteration of the digestive system are nausea and vomiting. Nausea is a vague but unpleasant subjective sensation of sickness or queasiness. Just ever felt queasy on your stomach, like you're going to throw up? It may or may not be accompanied by vomiting. Vomiting is the forceful expulsion of the contents of the upper GI tract, so it never gets past the stomach when you're vomiting. It's from contractions of muscles in the gut and the abdominal wall. Nausea and vomiting are symptoms of underlying disorders. Food, stress, medication, smells, and taste are common causes of nausea, vomit, and diarrhea. And think about somebody that's pregnant and they're just already nauseated and they just can't stand to smell certain things or eat certain things, and then they have the vomiting. Nausea and vomiting are commonly associated with food poisoning, drug and alcohol overuse, and infectious gastroenteritis. Individuals typically avoid foods, taste, and smells and use stress reduction strategies to relieve these symptoms. Many times this is enough to resolve the underlying source of the distress. Nausea occurs when the vomiting center in the medulla of the brain is stimulated. Distension of the duodenum is a common stimulus for nausea. The vomiting center can be stimulated by input from several sources. The GI tract, produced by distension, irritation, or infection. The vestibular system of the ear, so if your fluid's off in your ear, you can feel nauseated. Higher central nervous system centers in response to certain sights, smells, or emotional experiences. You ever just got emotional and your anxiety takes over and you just feel sick on your stomach? Chemoreceptors outside the blood-brain barrier that are stimulated by drugs, chemotherapy agents, toxins, systemic disorders, and pregnancy. Disorders such as acute myocardial infarction or MI, heart failure. These common symptoms of someone having a heart attack is nausea and vomiting. Increased intracranial pressure could be from bleeding or trauma or a tumor, and this produces vomiting that may or may not be accompanied by nausea. And so now you have some terms. Anorexia, this is loss of appetite. Emesis is vomiting. And GERDs, you have a lecture on GERDs, and I go into detail about the GERDs and heartburn and acid indigestion into that. Hepatitis, this is inflammation of the liver, could be caused from a virus, alcohol, medications, autoimmune disorders. Malabsorption is a condition in which the intestinal mucosa is unable to absorb nutrients. Common systemic manifestations you will see: weight loss because you're not absorbing the nutrients you need, weakness, malaise, muscle cramps, bone pain because, again, lack of nutrients, abnormal bleeding, and anemia. Selected causes of malabsorption include acute enteritis, AIDS, such as opportunistic infections, celiac, Crohn, intestinal ischemia or infarction, so you got death to the tissue, scleroderma, and short bowel syndrome. Malabsorption is a condition in which the preparation of the chyme for absorption of nutrients is inadequate, and you see this with pancreatitis, cirrhosis, cystic fibrosis, and Zollinger-Ellison syndrome. Pancreatitis is inflammation of the pancreas, and the clinical manifestations are abdominal pain, and it's painful. Pancreatitis is very painful. Nausea, vomiting, swelling, sweating, chills, fatty stools, and it smells terrible. The fatty stool smells terrible. Acute pancreatitis usually presents with upper abdominal pain, and you have severe episodes can lead to dehydration and, of course, low blood pressure. Chronic pancreatitis presents with upper abdominal pain and chronic weight loss. And some of the common causes are alcohol, trauma, cystic fibrosis, hyperparathyroidism, and certain medications such as corticosteroids, estrogens, thiazide diuretics. Pyloric stenosis, this is the thickening of the pyloric muscle resulting in a narrowing of the pyloric sphincter between the stomach and the small intestines. Usually occurs before 6 months of age and is usually diagnosed by 12 weeks. Symptoms such as projectile vomiting usually begin around 3 weeks of age, and this has to be repaired. Prevalence, you can read that on your own. On page 220, it gives you the alterations and therapies of digestion that I just went over in this nice chart. And so you can go back and read over the chart, and it will cover the things that I just went over on that piece. Genetic considerations, some of this, Crohn's disease is genetic, autoimmune disorders are genetic as well. And you see where genetics play a role in pyloric stenosis, celiac, and pancreatitis sometimes. Concepts related to digestion, this is on page 222. You have the concept of development, the concept of elimination, the concept of fluids and electrolytes, the concept of metabolism, the concept of nutrition, and the concept of self. So please read over that. Okay, I'm trying not to make this chapter's long, so I'm trying not to make it too long, so I'm going to gear you to some things to read in this chapter as well. Health promotion. Digestive health promotion involves lifestyle choices and management. Foods that support good overall health are essential for healthy digestion. Fruits, vegetables, whole grains, lean meats because they don't have as much fat in them, but we know the fat's what tastes good, but we don't need that. They all support normal digestion. While highly processed foods and those with high fiber fat content can have detrimental effects, some cooking techniques such as frying lessens the benefits of healthy foods. Beverages also affect digestion. Alcohol, caffeinated beverages, while adequate water consumption helps to maintain healthy digestion. Safe food and beverage storage and preparation practices are also important to avoid foodborne illnesses. We need to make sure if it needs to be cold or frozen, keep it that way. Don't go past the expiration date on meats and stuff like that because it can be very detrimental. Fiber, water intake, and daily physical activity promote healthy elimination. Responding to the urge to move the bowels, don't hold it. Go to the bathroom. Don't postpone your bathroom visits, especially children. Over-the-counter enemas and laxatives should be avoided unless recommended by your healthcare provider. Prescription medication use should be monitored for side effects that affect elimination. Avoid or minimize risk factors in daily life helps to promote healthy digestion. Identify causes of a digestive disorder. Because digestive disorders have varying etiologies or causes, prevention methods vary. For example, taking steps to prevent conditions that may lead to pancreatitis, such as gallstones and alcoholism. Immunizations on schedule, especially before traveling to developing countries, can help prevent infections such as hepatitis A and B, and then collaborate with your healthcare provider to stay in compliance. Modifiable risk factors, these are things that we can do. Individuals can reduce their risk of developing a digestive disorder through lifestyle choices. Modifiable risk factors can be controlled or altered to reduce the potential for digestive disorders. For example, GERDs can be prevented by maintaining a healthy weight, eliminating smoking because it causes the vasoconstriction and it affects the absorption, limiting alcohol and avoiding foods such as chocolate, caffeine, onions, citrus fruits, and spices. These are things we can avoid. Modifiable risk factors for viral hepatitis include unsafe sex, improper hand hygiene, sharing personal items such as toothbrushes and razors, and traveling to developing countries without getting the proper vaccinations. There is a link between pyloric stenosis and early use of antibiotics, erythromycin, for whooping cough, so that would affect children. Care in the community. Before we get to that, it talked about some screenings, and you can be screened for celiac disease. This is through a blood test, and then there's some autoantibody tests that can be done as well. Care in the community. At the individual level, patients may rely on interventions in the home to treat digestive issues or disorders. The appropriateness of these interventions depend upon the type and severity of the problem. Bland foods are appropriate for individuals who are experiencing nausea. Patients should avoid greasy or fried foods and sweets. Eating small, frequent meals may also help, not large meals, and not three large meals a day. Eating small, frequent meals, and I'm stressing that because I had that on the previous test. For individuals with nausea, vomiting, and diarrhea, the BRAT diet is usually well tolerated. BRAT. Bananas, rice, applesauce, and toast. Other bland foods are saltine crackers, boiled potatoes, broths. Individuals should drink water, sports drinks, and something such as nursery water or distilled water with fluoride added to avoid dehydration associated with vomiting and diarrhea. Juices and carbonated soft drinks increase the risk of dehydration. If the condition persists or becomes chronic, the patient should consult a healthcare provider. Now let's go back to sports drinks. I know you're thinking these are the sweets, but it's really kind of talking like Gatorade, the stuff that we use to really replace the fluids. Nursing assessment. Through assessment, a thorough assessment is necessary to determine the underlying cause of a patient's presenting signs and symptoms. Patients who present with nausea and vomiting require assessment to rule out the possibility of an underlying systemic disease or acute illness that may require immediate care, such as bowel obstruction, and that's a medical emergency. When the cause is known and if there are no other acute symptoms, nursing interventions focus on promoting comfort and preventing complications. The nursing assessment, we want to look at the health history, and there's some bullets here on page 224 that you should look at. You can read those on your own. Again, I'm trying not to make this too long because this chapter is long. But the health history, how's your appetite? What are the symptoms of your abdominal discomfort? What is your family history? And so again, we want to look at have they had any changes in their appetite, changes in their weight? Are you having a lot of nausea and vomiting? What are the things that you're doing that's causing this to happen? On page 225, it goes through the digestive physical assessment. Again, I'm not going to record this. Please go through, and we know that we should inspect, we should auscultate with our stethoscope, we're listening for bowel sounds, we percuss, and we palpate. On page 226, there's a malnutrition assessment. And so it talks about looking at the nails. Are they strong? Are they weak? Is the hair brittle? Look at the skin, the eyes, the nervous system, musculoskeletal, cardiovascular, and GI system. And so like I said, I'm going to not cover that. So we're going to jump to page 228. And at the top, it has a safety alert. Palpation is contraindicated in patients with appendicitis. Dissecting aortic aneurysm or polycystic kidneys is suspected. It is also contraindicated with patients who have had an organ transplant. So keep that in mind as you're doing your assessment, your abdominal assessment, if any of this occurs. Diagnostic test. The upper GI is conducted to diagnose esophageal varices. These are swollen vessels in your esophagus if they look like they're going to rupture and bleed. Inflammation, ulcerations, hiatal hernia, foreign bodies, polyps, diverticuli, and tumors of the esophagus. They look at the stomach and the duodenal bulb, and you have to be NPO for the test. and you may have to drink some barium for that. And then the nurses should instruct the patients who are undergoing upper GI not to smoke, eat, or drink fluids before the test 8 to 12 hours for an adult and 4 to 6 hours for younger children. Tell the patient not to take narcotics or anticholinergics for 24 hours because that'll dry them up, and not to take any medications for 8 hours for the pretest. Endoscopy, this looks at the mucosal membrane lining of the esophagus, stomach, and the duodenum. Again, you have guidelines here on what you should instruct the patient to do before they take the test and what they need to do after they take the test. Please make sure you read over that. If sedation is achieved using a combination of benzodiazepines and opioid agonists such as Versed and fentanyl, the patient may experience mild bloating, belching, or flatulence after the endoscopy procedure, and that's not uncommon. Abdominal x-rays and the CT scans. Safety alert. Assess patient for allergies to iodine or contrast medium before tests that use these chemicals, because they may have to, like I said, they may have to drink something, some kind of barium. And then a lot of times if you do have barium, you have to give them milk and magnesia afterwards so they can go ahead and poop out the stuff. We want it to clear, get out of their body and clear their kidneys. Amylase, normal amylase levels for an adult are 60 to 160. Amylase levels peak 24 hours after the start of an illness and usually drop to normal in 48 to 72 hours. No special preparation is needed for this test, though alcohol should be avoided prior to the test. And when you're looking at amylase and lipase, you're looking at liver function. Lipase, the serum blood test, measures the secretion of lipase by the pancreas, is useful in diagnosing pancreatitis. So again, amylase and lipase are good for, like I said, for liver and pancreas. Okay. Independent interventions, you want to promote fluid and electrolytes, and it lists some things here: clear liquids, tea, apple juice, broth, dry crackers, soda crackers. Make sure you follow your physician's orders. Patient education. Should focus on promotion of healthy digestion and management of digestive disorder symptoms. You want to look at habits such as sitting upright when eating, exercise regularly, and maintaining a healthy weight. You should sit up at least 30 minutes to an hour after you eat. Do not lie down after you eat. For patients with digestive disorders, education will be specific to the disorder, and we want to involve the family members as well, because they may be the ones that are cooking for them and stuff like that. Your pharmacological therapies, you have a chart on page 231. That's not the one I want to look at right here. That's not it. The chart on 231 is the type of medicines we give for nausea and vomiting. So what do we give for digestive problems? Antacids. And so some of the things you'll see are calcium carbonate Tums, magnesium hydroxide, milk and mag, and aluminum hydroxide. H2 receptor agonists, these are given for esophageal reflux and peptic ulcer disease. And some of the things that you may see are Pepcid or famotidine and ranitidine hydrochloride or Zantac. Now, you know, this book's a 2019, so Zantac's been off and on the market, okay? Proton pump inhibitors, and these are for short-term use of reflux disease and gastric ulcers. Commonly used are Prilosec and your Prevacid. Antiemetics, that's just what it is. It's given to help control nausea and vomiting. One of the most common that we give is Zofran. We used to give Phenergan all the time, but they've kind of gotten away from that because Phenergan has a lot of side effects. Look on page 231, and here's some medications used for antiemetics. You have antihistamines that help inner ear, like Meclizine and Avert. You have Zofran, and that's one of the most commons. You have your dopamine agonists, such as your Reglan and your Haldol, but now these make you very sedated, so you really have to watch the patient when they're taking Haldol and Reglan. They can get sedated on those, okay? And then, again, Reglan, it promotes motility by enhancing esophageal clearance and gastric emptying. Long-term use is not recommended because of the adverse effects that can occur. Contraindications include sensitivity or tolerance to the drug, lactation, allergy, or sulfite, ileus, and mechanical GI absorption or perforation. And I've known patients, I used to give Reglan all the time, and the doctors never did take them off of it. Now, what are some other things that we can do to give a patient nutrition that can't eat? We can do enteral nutrition or tube feedings, and these are given through a tube that's either down the nose or directly into the GI tract. These are used for people who have swallowing issues, such as from a stroke, or they're unresponsive, or they have oral and neck trauma, or like cancer. They can't swallow, or they can't get it down their esophagus. And so we'll give tube feedings such as like Gevity, Ensure. There's one for diabetic patients. It's not called glucophage. I can't remember the name of it. Anyway, there's one specifically made for diabetic patients too. And I didn't see it listed. Let me look again and see. There's Ensure Plus, Gevity, Nutrin, Pulmicare for people who have pulmonary problems. I don't see it, but there is one that you can give just for diabetics to make sure that you're regulating the blood sugar. Aspiration and diarrhea are the most common complications of enteral feedings. Procedures and interventions that reduce the risk of aspiration or continuous infusion of the formula. Placing the feeding tube in the jejunum rather than the stomach. The jejunum's in the intestines. Keeping the head of the bed elevated at least 30 degrees during feeding and for at least 1 hour. So if they're on continuous feedings, you need to keep the head of bed elevated at all times. Other things that we can give are TPN, and TPN is given IV. These are amino acids. They have added carbohydrates, fats, electrolytes, vitamins, and minerals. These hypertonic solutions are administered through a central vein, such as a subclavian vein. Particularly when therapy may be prolonged, they may be given through a PICC line. It is used for both short and long-term management of nutritional deficits. Many patients are discharged to home with TPN and monitored by the home health nurse. Some of the things that you'll see are 10% of more dextrose and added electrolytes, minerals, and vitamins, and fats. And sometimes these fats or lipids, they're given separately through a separate IV, and you have special tubing with a filter on it as well. And it talks about that, and it talks about having meticulous sterile technique with this because it is in a central line. The patient may develop glucose intolerance with TPN, and that is total parenteral nutrition, and you do need to know that. Particularly early in the course, the physician might increase the concentration of glucose in TPN solutions to reduce this risk. Laboratory personnel measure blood and urine glucose levels every 6 hours until insulin production adjusts to the increased glucose load. Patients with impaired kidney function or liver disease may develop excessively high blood urea nitrogen or BUN levels or metabolic acidosis. Hyperlipidemia is a common complication of fat infusions. These solutions are given intermittently to allow fats to clear from the blood between infusions. Fluid overload or dehydration may develop, particularly in older adults because they have underlying, they may have heart disease or so forth. The nurse should assess the lung sounds. You're checking to see if they've aspirated, and check for edema frequently to see if they're retaining fluid. And then there's diets low in fat, cholesterol, and sugar, and that's the kind of diet we should all eat. Fruits, vegetables, grains, and protein sources. And we've talked about that before. Non-pharmacological things, we need to look at increased consumptions of fruits, vegetables, and fiber, And decreased consumption of fatty or processed foods may be effective for improving digestive symptoms. Increased exercise helps promote motility and get our food going through. Complementary approaches or hypnotherapy, acupuncture. I've always wanted to try acupuncture. I would love to do that. And a variety of herbal remedies, peppermint oil, turmeric, and ginger. Emerging evidence suggests that patients may benefit from these approaches. Probiotics, and we are seeing a lot of probiotics given in the hospital setting, and this protects the body from harmful bacteria. They may be taken along with prebiotics, which act as food for probiotics. Probiotics and prebiotics may be found in dietary supplements as well as yogurt is a common source. Whole grains, bananas, and honey are good sources of those. And as far as the rest of the chapter, lifespan considerations, you can read this on your own because a lot of this is the same for adults as it is in children. So I'm trying to keep this short and not repeating anything that I need to say. Again, digestion in pregnant women, avoiding those spicy foods, fatty, greasy foods, staying upright after you eat, getting something for your nausea and vomiting, and drinking plenty of fluid so you're not constipated. I lost my feed there. So what I was saying was as we get older, we are dealing with decreased absorption and decreased motility in our GI tract, and we also lose our sensation of taste, so we don't always eat the right foods. So again, with digestion, it can depend on, if you've got stomach cancer or liver problems or alcoholism, how we eat, fatty, greasy foods, do you eat and lie down, are you pregnant, are you a child with pyloric stenosis, and then the type of feedings that we can do, TPN and tube feedings and things like that. Thank you very much.